Welcome to Making Inroads in the Indian AI Imaging Market, brought to you by the Case Study Series by Skilled MBA. This case explores Deeptech.ai, an ambitious health tech startup, and its mission to transform India's overburdened radiology sector through AI-powered diagnostic imaging solutions. It's a deep dive into trust, technology, and adoption in one of the most conservative segments of healthcare. India faces a pressing healthcare challenge, a critical shortage of radiologists amidst a growing need for diagnostic scans. Deeptech.ai proposes an AI-driven solution, not to replace radiologists, but to support clinical decision-making. But with innovation comes resistance. The company must navigate professional skepticism, ethical concerns, and complex B2B adoption dynamics, all while building institutional trust. To succeed, Deeptech must align its strategy across 4 key pillars. 1. Stakeholder engagement, align interests of hospitals, radiologists, and patients. 2. Trust building, establish credibility through evidence, empathy, and education. 3. Product positioning, frame AI as a partner, not a competitor. 4. Technology adoption, simplify integration and reduce workflow friction. These components must work together to drive widespread acceptance. This case teaches students to understand how consumer behavior and trust shape tech adoption in healthcare. Analyze the technology acceptance model in clinical settings. Craft effective marketing strategies for disruptive B2B health tech design. Market entry plans tailored for the Indian hospital landscape. It's a blend of behavioral insight, tech fluency, and strategic marketing. The classroom discussion will center around: what are radiologists really afraid of? Job loss, liability, or loss of control? How can Deeptech build trust while entering a skeptical market? Should they prioritize Tier 1 hospitals, diagnostics chains, or public institutions? What role does user experience and onboarding play in technology acceptance? And finally, how should Deeptech position its core USP, speed, accuracy, or affordability? These questions shape the roadmap for ethical and effective AI adoption. AI as co-pilot. Market AI as an assistant, not a replacement. Professional concerns. Radiologists care most about accuracy, credibility, and legal liability. Marketing funnel. A B2B2C approach, from hospitals to radiologists to patients, is more effective than direct-to-consumer. Holistic adoption. AI must be socially, emotionally, and professionally accepted, not just technically available. Deeptech is currently in the early adopter phase, with forward-thinking hospitals and tech-inclined radiologists. But true impact lies in crossing the chasm to the early majority, the pragmatic, cautious segment. This shift requires more proof, easier integration, stronger support systems, and a more risk-managed adoption process. Deeptech's communication must follow the ADA framework: attention, spotlight. India's radiologist shortage. Interest, showcase how AI supports accuracy and efficiency. Desire, use success stories to inspire belief action. Offer pilot programs with training and support. This staged model helps guide prospects through awareness to commitment. Using the 5 C's model: company, an AI innovator in radiology; customer, hospitals and radiologists, collaborators; tech providers and government initiatives, competitors; global imaging AI firms and legacy software. Context: India's strained healthcare system. These insights fuel market-informed strategy design. Deeptech's B2B sales must be structured, patient, and evidence-driven. Outreach: lead with the radiologist shortage demonstration. Show real results in real scans. Pilot program. Offer trial use in one department integration. Deploy across hospital systems. Scaling: expand post-success. The pilot stage is critical. It's where credibility is built or lost. Adoption depends on 2 key perceptions: Usefulness. Will this make my job better? Ease of use. Is this easy to adopt into my workflow? Deep tech must demonstrate time savings, improved accuracy, reduced repetition, and seamless PACS integration, all while minimizing training effort. Engage students with role play. Simulate a deep tech pitch to skeptical radiologists group project. Design a communication plan for B2B adoption design thinking. Redesign onboarding to reduce anxiety and build confidence. These exercises blend strategy with empathy, ideal for future marketers and healthcare leaders. This case has powerful market implications: 70% radiologist shortage, 3.5x growth in scans, 40% time savings with AI. Rs 250B AI market by 2030. Deep tech is poised to shape how India delivers diagnostic care with the right strategy. To scale impact, deep tech must excel in hospital partnerships training programs, technical integration success, documentation, government accreditation. Each step builds credibility and accelerates adoption. To accelerate adoption and trust in AI-powered imaging, DeepTech.ai must implement a multi-pronged, practitioner-first strategy. Here are 5 key recommendations for moving forward. Pilot programs. Start with low-risk, well-supported pilot installations in influential hospitals. These pilots generate case studies, success metrics, and internal champions, laying the groundwork for scalable adoption. ROI measurement. Clearly communicate the return on investment for both hospitals and radiologists. This includes metrics like time saved per case, reduction in reporting backlog, accuracy improvements, cost efficiencies per scan. Numbers build confidence and unlock budgets. Radiologist involvement. Engage radiologists directly in product development and testing. When clinicians help shape the tool better fits real workflows and earns greater trust. Certification. Pursue both government and industry accreditations, such as CDSCO, NABH, or CE approvals. Certifications validate credibility and satisfy hospital procurement requirements. Education focus. Invest in training programs, onboarding materials, and change management support. Smooth implementation minimizes resistance and speeds up impact. Thank you for joining us for Making Inroads in the Indian AI Imaging Market, presented by the Case Study Series by Skilled MBA. This case reminds us that technological innovation alone is never enough, especially in sensitive sectors like healthcare. Real change happens when products are built with empathy, delivered with integrity, and adopted through trust. We hope this inspires you to design strategies where innovation and inclusion go hand in hand, especially in places that need it most.